I was mentioning how radiation can also damage the inner lining of the coronary arteries, and this injury can promote the development of coronary artery disease, irrespective of other risk factors. We always think about diabetes, hypertension, high cholesterol, family history. That's why you get coronary artery disease. Well, you could also get coronary artery disease if you don't have any of those, but you've gotten radiation that exposed your blood vessel. Radiation is a risk factor for coronary artery disease. So if you look at these two panels here, on the C, these were people that already had coronary artery disease, and they divided people into low heart exposure from radiation and high heart exposure from radiation. And if you already had coronary artery disease, the extra radiation didn't seem to make all that much of an effect. Those two lines kind of crisscross over one another. There's not a whole lot of difference between the two. But if you look in panel B, those are people who did not have a pre-existing coronary artery disease. And although their overall risk is low, there is a bigger difference between those people that got low amounts of radiation exposure to the heart versus those that got larger amount. So in fact, the group that got the larger amount of radiation exposure to the heart, they had 3 times the risk than the people who had the lower amount of radiation. So that is kind of proof that the radiation itself is the risk factor. That kind of unmasked when you looked at people who didn't have coronary artery disease.